Welcome back. School is in full swing and report cards have just come out, and if your child's grades aren't what they should be, pay special attention in the next few minutes. With me is Dr. Amy Thomas from Arizona Vision Therapy Center. She's an expert at identifying issues that can get in the way of children learning and thriving in school. Dr. Thomas, so great to have you back here.
Hello, hey, hi again.
Nice to see you again. So, like I said, if you see that your child is struggling, what typically happens when a child is struggling? What do people and parents do immediately?
So one of the first things that happens is the teachers notice the kids squinting or they're getting their face really close to the book. So they say, okay, this has to be a vision problem. So they send the kid to the eye doctor. And the eye doctor, and we've got some good eye doctors in town. I'm not saying they're not good eye doctors, but they're not looking for this type of problem. They go out and they say, okay, so your kid's 20/20, or I got some glasses that are gonna make your kid 20/20. Okay, vision's okay, move on. But the problem is they're not covering everything that can be involved when it comes to learning.
Right.
It doesn't matter how clear the target is. If it's all double and it's giving you headaches and you can't find it, then you're going to end up having problems reading, having problems learning.
Well, and like you said, even if they pass that vision exam, they can still have trouble learning, and there's a real difference between a regular eye exam and one that's called a functional vision exam.
Yes. Okay, so the regular eye exam, they focus on 20/20 ocular health. Sometimes you get some focusing system tests in there, but usually not if you don't ask for it. What a functional test is, in fact, in our office we do about 33 different tests to figure out how your eyes and your hands coordinate, how your eyes and your body coordinate, how your eyes coordinate with each other. There's a whole bunch of things that go together in this one. I actually have an example here of double vision. So this is when the eyes are just not working well together. They're not aiming in the same place. In fact, most of the time it's because the eyes are pointing behind the book. You end up getting double vision that looks like this.
Makes me dizzy just to look at that. And you've also mentioned eye movements and how important it is that they coordinate with your hands, etc. You have another example showing problems in that area.
Yes, okay. So if you have that next example up real quick.
The popcorn test, I think they call it. There it is.
So the thing that's frustrating about this is when everything's going well, if the kid had a good night's sleep and they're very motivated to learn what they need to learn and they're doing great and they're not confused, then everything looks like this. It says, "Come on," said Betsy, "we have to pick up this corn." Now, if you can go to the next slide real quick.
The next one's going to be, so you showed me this a little bit earlier and I said, are you supposed to be able to read this?
Actually, yes, and a lot of kids do read like this.
Wow.
All right, so there it is again. "Come on," said Betsy, "we have to pick up this corn. We don't have another can of popcorn. Are we going to eat popcorn that's been on the floor?" So
that's
what
impressive
happens?
That you could read that.
All this effort that they'd been putting into making sure their eyes land in the same place, focus in the same place, and read the same material, it kind of slides when they have to load the task, when they have to use cognition. So that's when everything starts sliding and their eyes jump to places they are not expecting them to jump. So they spend most of their time decoding what they're reading instead of actually understanding what's going on.
Well, and I think a lot of children may have a lot of trouble describing what it is, right? So how can parents sort of do a test with them to help them understand what they may be going through or what they may be seeing?
Two very, very easy ones. Okay, so what it is if you're looking for double vision, you just go up and you say, okay, so if I go like this, when you're reading, okay, do the words do this? And then suddenly they kind of come out like this.
Okay.
And they do that.
Easy
and move
for
it just a
anybody
little
to
bit,
get.
And if you hear, well, sometimes it does. That's a red flag right there, because it's not supposed to do that.
Right.
The other one is just have the kid read out loud. If you're catching they're doing great and then they're skipping they're skipping lines, they're saying words backwards, they're saying the wrong word, then you most likely have a vision problem. And if you see it improve by them moving their finger along the text, absolutely you got a vision problem there.
It's about observing, it's about doing these little easy at-home tests, but then if you do notice a problem, how does vision therapy address these? What can be done for children with these issues?
Okay, so we got two big things we can do. We actually work with, they're called therapeutic lenses, and they actually get the eyes to learn how to work together as a team and track like they're supposed to track. Those are good for the short-term solution. For long-term, we want to train them how to use their eyes.
Right.
So I have a fun fact for you.
Okay.
Okay, so vision is learned. The only animals in the animal kingdom that have almost instantaneous vision are the ones that come out and they have the eyes on the side.
Right.
They don't have to learn how to get their eyes to work together. They don't have to learn how to focus, anything like that. So us, we're born like hunters. We're born with both eyes together. They have to learn how to get that depth perception.
They
to
develop.
get the teaming.
I see.
Yes.
That's
So we have to
fascinating.
teach ourselves how to do it. We actually do this during the milestones. So I'm going to go through real quick, okay? All right, so we first learn how to converge our eyes, which is cross your eyes, when you flex all your body parts like this,
Yeah.
okay? And then tummy time is where you get out like this and extend everything.
Right.
Teaches you how to uncross your eyes, like copying from the board. And then you got the army crawl where you go like this. It
Right.
teaches you how to get your eyes to go back and forth. And it also teaches you where your center is.
Okay.
So everything can go from that center.
Well, see, there's obviously so much to learn. This can benefit not only children, but if adults have trouble with focus too, adults can benefit from it.
Yes.
I'm going to give them information about this great deal that the Therapy Center is offering. As always, I want to thank you so much for joining
Thank
me.
you. All right, perfect.
Of course. Arizona Vision Therapy is offering 30% off their functional vision exams when you mention the MorningBlend. The offer is good through the end of this month, and to make an appointment or learn more, call 520-886-8800 or visit azvisiontherapy.com.